Hi guys, welcome back to the DrCliffAuD vlog. This is vlog number 33, and today I want to talk to you about a keynote speech that I gave for Phonak University. Now, Phonak University is basically a training retreat for graduate students in their Doctor of Audiology program, and it's usually students who are in their first or second year of their graduate studies. Now, the topic of my keynote was why different is better. So let me give you a little bit of context here. When I was a fourth-year graduate student myself, I happened to be lucky enough to get to go to a training that was led by Dr. Gus Mueller. Now, Gus Mueller has been a huge advocate for best practices and performing procedures like realer measurement, test box measures, what have you. And so at the end of that training, and I happened to be the only student that was at that training that happened to be out here in Scottsdale, Arizona, but he came up to me and told me, he's like, Cliff, if you want to be in the top 5% of audiologists, all you have to do is go print off the best practice guidelines and follow them. And so basically from that point of my fourth year externship, I really took that to heart. And it is basically what has shaped my entire philosophy on patient care in my clinic. So as I'm sharing this and giving my presentation to students, because I personally believe that best practices are the only reason why a hearing care professional deserves to have a job, to be quite honest with you. I mean, you can go and buy devices online, you can do whatever you want to, but at the end of the day, the additional benefit that you get from hearing treatment comes from hearing care professionals adhering to best practices. Best practices are those procedures that have been proven by research to improve patient outcomes, which is why I think it's so important to actually follow best practices. But we got to a point in this keynote where we had a survey question, and we're doing all this stuff remotely because we couldn't actually get to have an in-person meeting. So I'm pretty comfortable on camera, as you know, and so we actually did like a webinar for this. So we were able to basically have a survey for these students to answer. And so the first survey question that I asked was, when you graduate, will you provide best practice care? And the overwhelming response, 100% of the individuals, and we're talking hundreds of individuals who are attending this talk, hundreds of them responded with yes. And in fact, it was 100% yes, 0% no. So 100% of these students who responded said that when they graduate from their programs and they hit the real world and they are a practicing audiologist, that they are going to be following best practices. But I had to break the bad news to them because currently less than 30% of hearing care professionals follow best practices. Now, when you just look at realer measurement has probably 30 to 40% of hearing care professionals even ever perform realer measurement with their patients, and that is a critical best practice. But there are so many more best practices that go into it. And so when you look at the reality of the landscape in the hearing care industry, you're looking at probably significantly less than 30% of hearing care professionals will actually follow best practice care. So the question arises of, well, why does that happen? When you have students who totally understand that best practices are critical to maximize patient outcomes, then why do so few of them, when they actually hit the real world, provide best practice care? Well, there's a couple of excuses that go with this. Number one is I don't have enough time in my clinical setting to be able to follow best practices. They just take way too much time, and I need to see, this many patients inside of a day, and if I follow best practices with all of them, then I'm not going to get to every single one of those patients, or I'd be there basically all day and would never be able to leave. The next essentially excuse is my clinic doesn't even have all of the proper equipment to provide best practices. So this is a problem, right? You end up accepting a job at a clinic. They don't even have the facilities to allow you to perform best practice care. So what do? Well, you make do with what you have. You kind of do maybe some best practices, but you omit a lot of things because you just don't have the equipment to do so. The other common excuse is my employer won't allow me. So we have like the realer measurement equipment, we have the test box measures, but at the end of the day, they want me to follow a very specific process when dealing with patients. And they basically say, you know, we have this stuff, but you can't really use it because, again, we have to see this many patients. We got to make sure that you get them in, get them out, quit wasting time doing these best practices because these patients are willing to purchase hearing aids anyway from us. So why would we go ahead and do these other procedures when we already know that they're going to buy what we have to offer? So then it came to my next survey question, and this is my favorite survey question. So basically, at this point in my keynote, I was alluding to this idea that you maybe have to pick between what's best for your family and what's best for your patients. And I'll explain that here in a minute. So I just posed the question, which one's more important to you? Is your family more important to you, or are your patients more important to you? And the resounding responses were in favor of, well, my family is more important to me. And it was, I believe, 70% or more of the respondents said that my family is more important to me than my patients. And then you had about 30% that said, well, my patients are actually more important to me than my family. And I get that this has to do a lot with context. And I would say that my family is more important to me than my patients, but not when I'm providing care inside of my clinic. When I'm providing care to my patients inside of my clinic, best practices need to be implemented because at that moment in time, the patient is who's most important to me. And I really think that there's a conflict of interest that happens here. So if you go and you graduate from your doctoral program and you have tens, if not hundreds of thousands of dollars worth of debt, you need to find a job. You need to go somewhere who's going to pay you money so you can pay off your loan, so you can feed your family. I mean, a lot of these students coming out, they will be either married or just getting married, starting a family. So I get the idea that you need to be able to provide for your family. But at the end of the day, if providing for your family means that you are accepting a position or you're practicing in a way that does not put your patient's interest first, then that is a conflict of interest. And so just imagine if you were to go to a physician because you had cancer, and that physician said, well, best practices say that we should do this for you in order to attempt to cure your cancer. But my clinic won't actually let me do that. So I'm going to go ahead and do this, and you could do good with this at the end of the day, but I can't actually provide you with the best practice care because my clinic won't allow me. How would you feel if that's what your doctor actually told you? Well, in my eyes, this is exactly what a hearing care professional is saying when they say, yeah, I mean, I would love to follow best practices, but at the end of the day, the clinic doesn't have the equipment, they won't allow me to, it takes too much time. Those excuses are basically putting your family in front of your patients when you're applying care inside of the clinic. So this is the problem. Until we realize that as professionals, that our responsibilities lie with our patients when we are at work, we are not going to be successful as a hearing care provider. And if you choose to go and work at a clinic that does not follow best practices, or you can't follow best practices at that clinic, or they don't have the equipment to follow best practices at that clinic, you're essentially putting yourself and your family ahead of your patients. And to be honest with you, you could make the argument to say, well, that's okay. As long as I tell my patients saying, hey, you know what, we should be doing this because that would be best practice care, but I can't do it because, to be honest with you, I really need this job, and if I want to feed my family and pay off my student loans and all of that, then I have to go and treat you without providing best practices. The simple fact of the matter is that in order to be different as a hearing care professional and to do what is going to keep you in demand and relevant as an individual and as a profession, you have to be different. And the very simple way to be different is to just do the things that you're supposed to be doing, okay? And that is following best practices. This is the whole point of why we go to school. These are all of the things that we learn, and at some point along the way, we let our own self-interest get in the way and cloud our judgment for what's right for our patients. Here's another thing. When I was going into my 4th year placement, now to give you an idea how this works is that when you go into grad school to get your doctorate in audiology, it's typically a 4-year program. The first 3 years are where you're doing a lot of didactic, book work, test taking, clinical rotations, things of that nature. And then when you get to your 4th year, that is when you actually go on an externship. So you go somewhere outside of the university, you go work at a clinic, a hospital, or whatever, doing audiology. And it's basically, you're in charge of it. I mean, you have to go and apply for these different positions, you have to interview for these different positions, and it's pretty competitive out there. But what I said when I was getting ready to actually apply to these clinical rotations, or these clinical placements rather, is that I refused to go to any placement or even apply to any placement that didn't follow best practices. And maybe it wasn't comprehensive best practices, but the core foundational best practices like reader measurement, test box measures, patient-centered care, things like that. And I refused to even apply to ones. And so that really whittled down my options because, again, there are not that many places out there that follow comprehensive best practices. And so I basically removed even the potential that I would go somewhere that didn't follow best practices, so I had to basically sit there and provide subpar care to my patients. So if you basically remove yourself from the potential of even having to do that, and I understood that it restricted my placements. If I wanted to go to a very specific city to be closer to family or whatever the case may be, maybe I couldn't do that because I was only looking for places that was going to be ethical and moral for me to actually go to. So by the end of this talk, my hope was really that these students were hearing what I was saying and really making them look internally to be like, you know what? I get where the conflict is here. If I believe that best practices are the right thing to do for my patients, and I ultimately decide to go to a place that doesn't allow me to, or they don't have the equipment to, or they don't give me the time to, then maybe I can't actually practice there. Maybe I have to either start up my own clinic, maybe I have to leave and go to a different clinic that does follow best practices because they're out there. You just have to be willing to put your patients potentially in front of your family, and that means maybe uprooting and moving to a different location. Or if you want to be close to your family, maybe that means starting up your own clinic so you can do the things the right way instead of the easy way. My goal for this keynote talk was to convince one of those students, or to inspire one of those students to believe that best practice care is a non-negotiable. Best practices have to be done. And if one student came out of that keynote talk saying, you know what, I think Dr. Cliff was right. I think that when I'm going to be applying for my 4th year externship, when I'm going to be applying for an actual job, when I'm done graduating, I need to make sure that I go to a place that I can actually provide best practice care, or I go somewhere where I can start up a clinic and do things the right way from the get-go. And if I'm able to accomplish that, if I get a phone call or an email in 5 to 10 years from now and someone says, hey Cliff, I actually attended that keynote that you gave at Phonak U back in 2020 during the whole COVID thing, and that talk convinced me that I need to make sure that I follow best practice care, then I will have done my job well, and that keynote talk would have been well worth it. All right, guys, that is it for today. I hope you enjoyed today's vlog. If you've missed any of my other vlogs, of course, you can check them out on my YouTube channel, and as always, I will see you next week.